The Katie Beckett packet does not need to feel overwhelming. Today I'm going to break down each form in the packet, explain what you actually need to include, and give you the confidence to get it done.
Raising neurodivergent kids is messy, beautiful, and a lot. I'm Mary Ellen Yates, and this is Growing Together, Neurodiversity at Home. Let's figure it out together.
Let's get started. I just finished the process of getting approval for 2 of my sons for the Georgia Katie Beckett deeming waiver for Medicaid. You can check out my other videos about the process and the timeline and all the experiences I went through. But today I'm going to focus on what the Katie Beckett packet actually looks like. I'm going to go over the forms and the supplemental documentation that I included. So I'm going to share my screen so that you can see the paperwork. The Katie Beckett office included this checklist when they gave me the packet. When I submitted the packet, I had the checklist, and then I had a table of contents with the documentation listed in order so that they could find whatever they were looking for. And so it pretty much just looks like a cover sheet, and then it just lists all the documentation. So back to the checklist. The first thing on the checklist is proof of income, and so I included my husband's pay stubs for a month. The next thing on the list is proof of citizenship. I included my kid's passport and their birth certificate. I don't think you would need to do both of them, but that's what I did. The Katie Beckett office person that I spoke to said I didn't need to submit original documents, that copies were fine. And then it says social security card, so I included a copy of that as well. And then it says copies of bank statements and copies of any award letters. So these would be if your kids have any bank accounts, if they have any funding, if they get child support money, anything that would be in their name needs to be included. So for this, I just included the denial letter that I got from the Social Security office because my kids don't have any accounts in their names or any funds. This checklist does not say that you have to have a copy of a denial letter, but in all of the videos that I watched, they mentioned including that. So this is something you could clarify with the office when you're talking with them. So let's first go over the regular Medicaid form that you'll need to fill out. So you see there's a checkbox for Katie Beckett. Check off that box. My kids were not in foster care, so I clicked no in this box right here. This application is for your kids. You're putting their information. So I put my son's name, their address, and I said that I was okay with electronic communication. You can also say no. And then you put the date, phone numbers, email address. That for these, I put my phone number and email address since my kids don't have one. And my preferred language is English. Obviously, if that's different, you would adjust that. And you put if you need an interpreter. I did not need an interpreter, so I would put no. This area for disabilities and accommodations does not apply to us, so I skipped it and just put that I did not need any reasonable modification for communication. And I skipped all this. This authorized representative would be if someone else is filling out the form for your family. I filled out all the forms myself. I also want to put it out there that I am not a lawyer or an advocacy worker or a medical professional. I am just giving the information on how I filled out the form. So definitely do your own research. And in this packet, you'll see that most of the forms also have instructions with them too. So take a look at those. But so anyway, they're asking for all the members of your household. So you list everyone that's living with you and their first name, middle name, last name, their race, sex, date of birth, their relationship to the applicant. So for my kid, and then it was his self. And then for the other ones, it was brothers and sisters, mother, father. And we do have other health insurance through my husband's work. So we said yes. I put everyone's social security numbers. I put that we were citizens, so yes for everything. And my child lives in my home, so I put yes. And then for my husband and I, at the bottom, I put NA because we're adults, we're not children. And then this asks if the mother is living in the home, and that's yes for all the kids, and then NA for myself and my husband. And then this is asking if any of the members of the household are immigrants or nationalized citizens. That is not our family situation, so I put NA for this section. I put that my son was not pregnant. I put that he did not terminate any pregnancies. So for all of these, I'm putting no because obviously he's a boy, and so none of this applies to him. And then it says, do you have any unpaid medical bills from the last 3 months? And I checked yes, because we were getting services and hadn't received a bill yet, and we're hoping that Medicaid will be covering the cost of that. So I hit yes. And this is a situation for a lot of people. And then I put the months that would apply that I'm hoping for them to get coverage. And then it asks, are you currently covered by any other health insurance? I checked yes. And then it asks, are you currently on Medicaid? That would be yes or no, depending on if you have Medicaid right now. But then you put your insurance information, and then you put your insurance information if you check that you do have insurance. And then it says, does anyone in the household have private insurance? I checked yes. And then it's hard to see here because it's kind of cutting off at the very end, but it's asking if anyone in the household has been diagnosed with breast or cervical cancer. That was a no for our family. And then it asks if you've received women's health Medicaid, and I put no for my son. And then I put the insurance information for my private insurance down here because there was a little more room to write. And I put my husband's name and his date of birth because usually they want to have that information. So I put that since he's the one that is the card holder for the insurance. And so now we go on to page 3. This is talking about the kid. So I put no income. And since I had the proof of denial from Social Security, I put C, attached proof of denial or proof of ineligibility. So I don't know if you need to fill this out. I did, since it says, does anyone in the household file for taxes? Well, my husband and I do. I don't know if this is the right thing to do or not. So that might be something you want to check on for yourself. My son doesn't have any type of self-employment, so that was deductions, NA, NA, NA for these things. And then on page 4 of the Medicaid packet, I did not want my children to be evaluated for medical assistance using the ELE process. I said no, since I didn't think this applied with the Katie Beckett, but I don't know what the correct answer for this is. Yes, I am a U.S. citizen, and I'm giving everything to the best of my knowledge, no perjury. And then I signed and dated. And so if you have someone that's filling out the form for you, they would also be signing and dating. On page 5 of the packet, it asks about voter registration. And I checked no, my son isn't of age to vote. And then this is giving you information about your rights. And it does have a voter registration card and the envelope, I guess, if you put it together. And they have that included in the packet as well for those that would like to vote. Next in your packet is a health insurance information questionnaire, also called Form DMA 285. These are the instructions. It has tips for how to fill out certain parts of the application. Page 2 of the instructional guide. And here's the actual application. Case name was my son, but our address. If you have a case number, you put it there. Put their social security, and I put my phone number. This was an initial application, plus I checked off a HIPP referral. And then this asks if the person that is applying has private group or government health insurance. And I put no for that because my son does not. But then the next question asks if your parent does. So I checked yes for that. And then it asks if the policyholder is an absent parent. I checked no. And then it asks for all the covered individuals on this plan. So I listed all of our family. So if you have more people, you'd probably say see attached and put it on another piece of paper behind this application. Are any of these people pregnant? I put no, but obviously if someone is pregnant, you would put that information. It says attach a copy of your insurance card. I put the copies of the insurance card behind this application. And then this asks, do any of the people in the household have chronic conditions? And so I said yes. And I listed my 2 sons here. And then I said see attached when it says condition. And then for that, I had a supplemental document where I had each kid's name listed and their diagnoses. because they really do not give you a lot of room to put this information. And then I put our insurance information here. I signed and dated, and then my husband signed and dated because he's the insured or authorized person. So we both had to sign this one. And that was it for this application. And so the Medicaid application and this health insurance application are the two that you're just going to fill out by yourself that the physician doesn't need to sign. And now I'm going to show you the documentation that you're going to have to bring to your care provider. You really need to be showing them how to fill it out. So let's dive into the physician's recommendation for pediatric care, also called Form DMA-6A. It has instructions for each item in this application. So point out the instructions for them. I checked off TEFRA Katie Beckett at the top here, and then I put my son's name. I put the county that we live in, and then I put our mailing address. If your kid has a Medicaid number, you put it here. If they don't, you put NA. Put their social security number, put their gender, their age, their birth date, the name of the care provider, and I put my phone number. So for number 7, it asks if the provider thinks that the kid would require institutionalization if they did not get the community resources. So, and by checking yes, you're not saying that your kid needs to be institutionalized. You're saying that, yes, they definitely meet the criteria, but they're getting community resources instead. So make sure they definitely check this off. And then it asks if your kid attends school. We homeschool. I still checked off yes, homeschool counts. On the instructions, it says that number 9 will be completed by the county staff. And then I'm caregiver number 1. My husband is caregiver number 2. And then I put my signature and my date. And so this part was for me. Then this next area is going to be for the physician. Number 12, it asks for the child's medical history. If your kid needs Katie Beckett, they probably have an extensive medical history. So I said, please see attached for more detailed information here. And then that's going to be one of my supplemental documents going over their medical history. And if your kid has been with the same care provider their entire life or most of their life, they can probably do a really good medical history. So we've only been here a year. So I did the medical history and then the care provider signed it. For diagnoses, I listed 3 of the diagnoses and then I said see attached for more information because my kids have way more than 3 diagnoses. And you put in their ICD-10 codes there too. And then medications, I just put see attached. One of my kids has 1 medication, so I could have just put that on this line and didn't do a supplemental form, but I did do one for each of them just because when I do renewals, I'll have that supplemental document already there and I can just edit it, where if I wrote it down, then I would have to refill out that information the next time. So I just wanted all of as much supplemental documentation as I could so that I have an easier time in the renewal process. But anyway, so I put see attached, and for this it says diagnostic and treatment procedures. I said see attached. For treatment plan, I said see attached. And then for 17, it asks if there are any anticipated dates of hospitalization. So if you have a kid that has a lot of procedures and a lot of medical issues, then you'd be putting something there. But for me, I put NA because that doesn't apply to us. And then level of care recommended. Number 18 is also very important. They need to put what they recommend. We do not qualify for nursing facility because we do not get nursing care, but we do qualify for the ICF ID facility. So that would be kids that have more behavioral needs and need a lot of therapies and stuff, but not nursing care. So if they're not getting care from a nurse, it's going to be this one. They are at their home and we want to continue where they are. Now, if we're not changing their level of care, so I checked off continued placement. I want them to continue to be placed in my home and getting community resources. And then number 20 asks patient transferred from, and I put lives at home. So this is obviously going to change if your kid has been in a facility. If they've been other places, you're going to check different things. So Number 21, it says length of care needed. So they're looking at, is this temporary or is this long-term? A child might have been in an accident and needs months and months of rehab, but it won't be forever. They have a good prognosis. And so this could be just a temporary thing. So in that case, doctor would put the amount of time that they think this kid is going to need all these therapies. But if this is a chronic condition that your kid's going to have their entire life, you're going to be putting permanent. And then you're going to answer if your child is free of any communicable diseases. That's going to be based on your history. For us, it was no. So for number 23, it's asking if the care being provided for the child or that needs to be provided for the child, if it can be done in the community or in the home. And so since we get community therapies and in-home therapies, the doctor checked off both boxes and the physician wrote his name. And then he wrote the address of the clinic that we go to, and the physician signed his name. He dated it. He wrote his license number, and he wrote his telephone number. Page 2 of the DMA 6A form, it's asking about nutrition. My kids have a regular diet, so I checked regular. Now, if your kid has a feeding tube or other needs, then you're obviously going to check off those boxes. For bowel, I put that my kid is continent. That means that he's toilet trained. But if your kid is not toilet trained, or if they're too young to really be potty trained or any of that kind of stuff, then you're going to check off those boxes. Cardiopulmonary status. For us, my kids are on room air, so that's what I checked. They don't have any oxygen needs, but you would obviously check those off if that's your kid. Mobility, obviously you're going to put what applies to your kid. One of my kids, I put normal. For the other one, we listed that they had an abnormal gait. And then for behavioral status, if you're mostly using nursing care, your kid might be alert and cooperative. But if you're applying for the other level of care, then you're not going to check off these, and you're going to need the Psych eval because you're going to need to show that they're having a hard time and why they're needing these therapies. So we checked off that they were alert, they had developmental delay, behavioral problems, and you can put whether your kid is suicidal or not, or if they're hostile or not, are they very aggressive. Definitely want to check those off if that applies to your kid. In this little area here, we put some things like frequent redirection, yelling, at times transitional issues, whatever applies to your kid that is often something you're dealing with behaviorally. You could just put those little comments to give them a little more information. So we did that there. For integumentary system, they don't have any wounds. So for this one, urogenital, they're asking if they're continent, which means that they're toilet trained, or if they're incontinent, meaning they're still needing diapers or some kind of assistance to help with urination. So you'd put that information there. Surgery, my kids aren't having any surgery, so I put no, but obviously if you're applying for medical needs, this might definitely be something you're checking. Yeah, it looks like they're asking for the amount of surgeries that they've had. So the therapies and visits, they're asking you to check off whether they're high tech and they're needing a lot of therapies, or if they're low tech and not needing as many therapies. And so for high tech, that would be more than 4 visits a week. And for low tech, it would be 3 or less, or more frequent doctor's visits. So for us, we put high tech because we have 6 to 7 regular therapy appointments per kid every week. So they're definitely more than 4. For neurological status, I put neurological deficits. For 39, other therapy visits, it asks if they get it 5 days a week or less than 5 days a week. To qualify for Katie Beckett, they're going to need to have at least 5 visits a week of therapy appointments. So this question will determine your eligibility. So I check on the at least 5 days a week box. And for remarks, this is where my doctor included the full IQ score and the adaptive function score. Those are required components of the Psych eval for application, but this was another good spot for the doctor to put it just to emphasize what those scores were for their medical reviewers. It has pre-admission certification number. This didn't apply to us, so I put NA. My doctor dated it, he printed his name, and he signed. And then do not write below this line. That's blank. So that is the end of the DMA 6A form. At the end of the physician required forms, I'll show you examples of what our supplemental documentation looks like. Now we're on to the instructions for the Katie Beckett medical necessity or level of care statement. So I put my son's name, date of birth, social security number, diagnosis, main diagnoses. I also have see attached for complete list. And then they have to check off one of these boxes for the level of care recommended, either a nursing facility or one that's for the ICF ID, which would be an intermediate care facility. And so for us, we checked off the second one. And then medical history, you could just put see attached. And then here, this can look a little confusing because it looks like you just check off the things that apply, but you have to look at the headings. And this is saying current needs, and then it has none or description of their needs. So for us, we had no cardiovascular needs, so we checked off none. Then for neurological, we put speech therapy, occupational therapy, physical therapy, ABA. Respiratory, we put asthma and allergies here because we do need to give nebulizer treatments and things like that for one of my sons. And then for nutrition, we checked off the box here. There was no nutritional needs. There was no integumentary needs. There was no urogenital needs. There's no bowel needs. So we're just checking off none for all of these. For endocrine, my son has another condition, and so we put that condition here because we do see an endocrinologist for follow-up for that. For immune, we checked off none. For skeletal, for one of my kids, we put his atypical gait here. And then for other, we put behavioral. And then for therapies, we put where we were getting. So we get 1 session a week of speech for one of my kids, 1 session of physical therapy, and 1 session for occupational therapy. For my other kid, we just put 0 because he doesn't get physical therapy. And then we also added ABA, and we put the number they get. And then this says attach current notes. So whatever you're putting here, these are the 90 days of notes that you're going to need to attach at the end of your application. Hospitalizations, we didn't have any hospitalizations, so we put A. Child in school, so you would put the amount of hours that they are in school per day. For the state of Georgia, homeschool law says that they need to have 4.5 hours of equivalent school. So I put 4.5 hours. We do school 5 days a week, or we do not have an IEP. And then in attendance doesn't apply to us, so we checked NA. And then skilled hours received, again, NA. Physician signed, I signed, dated. And then we have the instructions for the Katie Beckett cost effectiveness form. This is the DMA form 704. So what they're looking for here is they're looking to see if it is cost effective for them to provide Medicaid, or if it's cost effective for a kid to be in a long-term facility. To say that the child's physician needs to complete this form. I'm sure the front desk or billing has our exact insurance breakdown, but I also found it online in our portal, and so I just put that down so that it would be easier for him. And so I put how much pays after deductibles are met for doctors, specialists, and then how much our max out of pocket and our individual out of pocket was and what our deductibles were. And then I looked at the services that we used for the last year. And then I divided that amount by 12 to show Medicaid would be for these services per month that our other insurance didn't cover. So I split it up into physician services, durable medication equipment, medications, and then I put for each kid what they were averaging because there's going to have to fill out a form for each kid. And then for one of our therapies, I asked them to give us a breakdown because we had just started with them, so we had not received any of the bills of what we would be needing to pay out of pocket. That was what this table is, showing what it would be for each kid. So then my son's name, you put their Medicaid number if they have one, diagnoses, and you can say see attached, and then prognosis, they put significant developmental with therapy and treatment, able to make progress, and then they're asking for monthly costs for these things. So the form that I gave the doctor had it broken up so it'd be easier for them. Their estimate for physician services, equipment, drugs, therapy, skilled nursing services, or if there's an other. Our son also does receive counseling, so we put that there as an other. It's not something that qualifies him for Katie Beckett, it's not considered a rehabilitation therapy, but it's still something that they would be paying for regularly. And then it says, will home care be as good or better than institutionalized care? We put yes. And then he made some comments about private insurance, how much they pay after the deductibles met, and the out-of-pocket max and stuff like that, which I had included in the paperwork that I had given him. And so then the physician signed and he dated. So let's go over the supplemental documentation that I enclosed. To provide privacy for my kids, I blocked out a lot of them. I hope this still helps though. But for medical history, I just wrote a medical history from birth to current. My doctor could have totally written and created his own, but he just signed my copy. So all these, I had a header that said Katie Beckett application, and I have the kid's name and I have their date of birth. And then I had a title, which I'm not sure why this doesn't have a title, but I had a title that listed the forms that asked for this information. So for the diagnoses, we saw on the different physician forms that the DMA 6A form on question 13 asks for the diagnoses, and then level of care form asked for it, and the cost effectiveness form asked for it. So I just put that as the title, and then I listed all the diagnoses, and then my physician signed it. And then for medications, for a title that said DMA 6A number 14, because that was where they asked that question, and we have all the medications listed. This is how it would look for melatonin. The dosage, the route is mouth, and the frequency is every bedtime. But for my other kid, he had quite an extensive one, and I didn't show his. And then you could title it DMA 6A number 15, and then have diagnostic and treatment. And then you can list treatment procedures they might be getting, and then a treatment plan, things that they should be getting, and then rehabilitation services, you're just listing all those services that they're getting, and then the reason or diagnosis for those things as well. The next thing you'll need from your physician is an order of medical necessity for the therapies. This is ideal on their letterhead and then written out, but some say that the doctor did on a prescription pad. But this would be an example of what they would maybe be including in this. And so you would have their date, you'd have the child's name, you'd have their date of birth, like we have up here. And if they have a Medicaid number, you'd be putting that. And then you'd say these are the following services that are medically necessary for my patient. And then you'd put how many times a week they need to be getting these services. And then you could put a disclaimer right here. Like we would be able to continue these ordered and medically necessary therapies soon due to cost if not approved, or you'd put they're waiting to start these therapies once Katie Beckett had approved to be able to financially be able to afford them. And then you can put other information if you want here, but you don't have to. And this is another part that you could put what their scores were for the psychological eval if you wanted to include that information, just to show that they really do need these therapies, but it's not a necessity. And then they're going to sign. So in the packet, they're going to have this handy dandy reminder form that says all therapies, whether school or private setting, they are asking for supporting documentation for these things. And I just included this paper that they provided, and then I put all of the notes. So that would be occupational therapy, physical therapy, speech therapy. If you have nursing notes, you'd include that. If you get ABA services, you'd include that. They want 90 days of all that. And then if you have a lot of hospital visits, discharges, you'd put that there in this area too. All of these need to be signed and dated. You want them as current as possible. And then you're including the physician's order for medical necessity with this as well, to show that we just went over. You definitely want to make sure they're dated and signed. So you're going to need to send in a eval, psychological eval. Two different types. There's a developmental eval. These are for kids or for 5 and younger. The moment they turn 6, they need a psychological eval. And then these evals are only good for 3 years. So you want to make sure that your eval is current. And then it lists types of providers that can provide these evals. They have to have certain credentials. And then down here, it says the psychological report must be signed by an approved evaluator and must contain the IQ score and the adaptive function testing, including an overall composite score. So if you haven't gotten your eval, just make sure they really emphasize those things. And so again, as down here, if you checked off that your kid is not alert and cooperative on that DMA 6A form, then you definitely need this psychological report. Very important. Okay, and then at the end of the packet, it has the HIPAA paperwork, which if you've gone to any care provider, they have you fill out your right to be protecting your medical information. So they have you fill out this form, read it, make sure you agree with it. There's quite a few pages. This is page 2, page 3, page 4, page 5, and then it says signature page to follow. And so you're going to go to this page and you're going to sign and date and print your name. And then let's talk a little bit about the HIPP paperwork. In the packet, it gave instructions to not send it with the Katie Beckett packet, but to send it to HIPP directly.
HIPP is a separate premium reimbursement program with its own application. I'm not covering it here, so this video stays focused on the Katie Beckett packet. Watch my short HIPP walkthrough, linked in the card and description, for how to fill it out and the common pitfalls.
If you have any tips and have gone through the Katie Beckett process and you'd like to leave those in the comments below, I would love to read them, and I'm sure other viewers would love that help as well. If you have any questions, let me know in the comments below too. And remember to like and subscribe below, and I look forward to talking to you next time. Bye.